Hello and welcome back to session 3, just before session 4 of the live stream. And for this session, I am going to kick off with an interview with DIXON Chibanda. Hello, welcome.
Thank you.
So you've come from the University of Zimbabwe, where you work on global mental health. And a part of your work is something called the friendship bench, which looks very different to what some people might consider conventional mental health treatment. Could you describe for people who maybe missed your talk what the friendship bench involves?
Yes, certainly. Thank you. So the friendship bench is really a brief psychological intervention delivered by trained community grandmothers. So grandmothers in Zimbabwe are trained for a 1-month period in the basics of cognitive behavioral therapy, with an emphasis on what we call problem-solving therapy, bits of behavior activation, and activity scheduling. And after the training, they are allocated a park bench in their community, and people are referred to them for sessions. And that's in essence what the friendship bench is all about. You know, we're working with elderly women in the community to provide treatment specifically for depression, you know, to really narrow the treatment gap, so to speak.
A month is such a short amount of time. What do you kind of manage to cram into that, and what do you have to leave out from, I suppose, conventional CBT training?
So the most important thing in the training is the problem-solving therapy. Teaching the grandmothers to be able to facilitate dialogue, to enable people to share their lived experiences, and while doing all of that, to be able to simply list the problems that a person presents with. And then the big chunk, as far as I'm concerned, the biggest thing that the grandmothers have to do is to learn how to summarize what they hear. And once they summarize what they hear, they kind of throw it back to the patient, and the patient endorses or the patient adds onto that. And then they invite the patient to select a single problem to work with. So in a nutshell, that's what they do. And then they help the client to work through that one problem that they've selected.
In your talk, you described this as a way to, I suppose, provide more access to therapy. Just how big is the gap between the need for therapy, for interventions, for mental health problems, and the provision that we currently have in different parts of the world?
The gap is massive. When you think of the ratio of, say, psychiatrists to the population in most low and middle income countries, you're looking at one psychiatrist for 1 million, in some cases 1.5 million people. So that treatment gap is huge. It literally means that 90% of people requiring this evidence-based care will not get it. And one way of bridging or reducing that treatment gap is to train ordinary people in the community. And that's why we are working with grandmothers. I'm not saying one cannot work with people who are not grandmothers. There are programs that use people who are not grandmothers. You know, the important thing is they are community members who are not professionals but are empowered with the skills to actually provide some input.
Now, going into your talk, I kind of assumed the point would be access and that would be the main problem it was overcoming, but the way you presented the evidence of the success of the program is actually rivaling what we would consider some conventional interventions for these mental health problems. Were you surprised to see just how successful sitting down on a park bench with trained grandmothers could be for mental health?
Yes, to be honest, I was very surprised. I did not expect such a huge effect size in terms of the difference between the grandmothers and your traditional sort of methods of care, which is the mental health nurse or the psychiatrist. And I think, over the years, what I've realized is it's not just about the science or the clinical aspect of it, but it's really about the connection. There's something that we call in psychotherapy, Therapeutic Alliance. I think the Therapeutic Alliance, or the strength of the Therapeutic Alliance in a situation where you are providing therapy within this kind of platform on a bench with an elderly person who is respected and trusted, I think the Therapeutic Alliance can be quite powerful. And I think that's one of the contributing factors that we don't normally give credit to when we talk about Friendship Bench, but I think that's critical. Yeah.
And although you've said it could be other people from the community, you have deliberately selected grandmothers to work
Yes.
with. What inspired that? Is there some evidence that inspired that, or is it just you thought that would be a nice place to start? What led you to work with grandmothers in particular?
So the main reason was because there was no one else to work with, actually, to be quite honest. The Friendship Bench developed in response to a crisis in Zimbabwe. And at the time, I couldn't work with doctors or the clinic nurses. There was hardly anyone to work with. And the authorities made it clear that the only people I could work with for this project were grandmothers. And that's why I actually started to work with grandmothers. And to be quite honest, I was initially skeptical. I actually didn't think it would work. So, as they say, to cut a long story short, we all have been pleasantly surprised at the effect these grandmothers have had.
Now, of course, some of the people visiting these grandmothers are quite a different generation to the grandmothers themselves. Does that pose any issues? If patients or participants are expressing problems which are maybe specific to their generation, or there might be different societal norms between their generation and the grandmother's generation?
Yeah, well, so that's a beautiful question. That's a great question. In fact, yes, that is an issue. Younger people often are not too keen to sit down on the bench with a grandmother. Some are, but in response to that, one of the things that we're doing is exploring how we can integrate young people to provide peer support on the Friendship Bench, because we do realize that not everyone is comfortable sitting with a grandmother. So we are working towards that. It's something that we are looking into, our team, and the results seem promising at the moment. Yeah, so that is an issue not to be ignored.
And this isn't something that's just being worked on in Zimbabwe. You've introduced this in New York, is that right?
Yes, so we were invited by the New York Health City Department, to help introduce Friendship Bench, which is what has happened, and it's running smoothly. And of course, the model in New York City, although it's based on Friendship Bench, it's slightly different, and we've also introduced this model in other parts of the world in sort of small scale. We're now trying to really take things to the next level in places like Malawi, Zanzibar, and more recently in Kenya. I think that the only place where we've truly scaled up, is Zimbabwe, but we're now thinking of really scaling up in all the other areas that we have Friendship Benches.
How do you begin to do that? How do you mass produce the Friendship Bench?
So we mass produce the Friendship Bench by clearly defining who the doer at scale is going to be. That is, as Friendship Bench, we're a small team. We're only 16. And so we have to be certain that we have the right doer at scale. And of course, there's the person who pays to take it to scale, the payer at scale. And right now we're using what is something similar to a franchising model, where we deliberately select partners that we feel could be good doers at scale, and we provide them the package, the Friendship Bench package, to actually go to scale within their organizations, within the government, and within other structures, existing structures. Like we are planning at the moment to go to Rwanda, where we've been invited by the government of Rwanda. And of course, that would be scaling through the government of Rwanda, where they have thousands of community health workers. So in essence, Friendship Bench will simply be providing a package to train community health workers in Rwanda, who then become the doers at scale, and we become a technical partner.
DIXON, thank you so much for joining us, and actually for bringing the Friendship Bench to Falling Walls as well. Have a great rest of your conference.
Thank you.
Thank you.